Welcome to today's deep dive on SIBO, small intestinal bacterial overgrowth, a gut health issue that's getting a lot more attention these days. If you've been dealing with digestive discomfort like bloating, gas, or unpredictable bowel movements, you might have heard about SIBO, but what exactly is it, and how can you tackle it? In this video, we'll explore what SIBO is, why it happens, how it's diagnosed, and all the treatment options available. We'll even talk about how to prevent it from coming back if you're already dealing with it or at risk. So, buckle up and stay with me till the end, because we're diving deep into the world of gut health. First up, let's break down what SIBO actually is. SIBO stands for Small Intestinal Bacterial Overgrowth, and it happens when bacteria that are normally found in your large intestine, the place where digestion wraps up, end up migrating to your small intestine. Now, the small intestine is supposed to have a much lower concentration of bacteria because it's mainly where nutrient absorption happens, but when bacteria from the colon start overgrowing here, it can wreak havoc on digestion and nutrient absorption. These bacteria start fermenting food too early in the digestive process, causing uncomfortable symptoms like bloating, abdominal pain, gas, diarrhea, or even constipation. And because they interfere with nutrient absorption, SIBO can also lead to malnutrition, vitamin deficiencies, and a host of other health problems, including fatigue, skin issues, and even brain fog. Now, let's get into the reasons why someone might develop SIBO. Spoiler alert, it's not just about what you eat. There are a ton of factors that can throw off the balance of bacteria in your gut. Here are some of the most common causes. Gut motility refers to the natural wave-like contractions of the digestive tract that help move food along. If your gut is moving too slowly, bacteria get a chance to hang out longer in the small intestine, leading to bacterial overgrowth. This is common in conditions like gastroparesis, delayed stomach emptying, or even after certain surgeries like gastric bypass. Some people develop small pouches in their intestines called diverticula, or they might have a narrowing in the intestines, called strictures, that can trap bacteria. When food and waste material linger in these areas, they create a perfect breeding ground for bacteria to grow. Stomach acid plays a critical role in keeping bacteria in check. It's like the body's first line of defense against bacterial overgrowth. But if you're on medications like proton pump inhibitors, PPIs, or you naturally have low stomach acid, that can allow bacteria to thrive in your small intestine. Speaking of medications, overuse of antibiotics can kill off beneficial bacteria, creating an imbalance that promotes SIBO. PPIs, as we just mentioned, also reduce stomach acid, which further contributes to the problem. Conditions like Crohn's disease, celiac disease, diabetes, and even thyroid disorders can all slow down gut motility or lead to nutrient absorption issues, increasing the risk of SIBO. What's more, the ileocecal valve is like a gatekeeper between your small intestine and large intestine. If this valve isn't working properly, bacteria from the large intestine can sneak into the small intestine, setting the stage for overgrowth. Alright, let's talk about symptoms, because this is where a lot of people start suspecting they might have SIBO. Here are some of the most common ones. Bloating, that I look 6 months pregnant after eating feeling. Gas, and we're talking both burping and flatulence. Abdominal pain or cramping. Diarrhea, sometimes explosive, but also constipation, which is why SIBO can mimic IBS. Fatty, floating stools, a sign that you're not absorbing fats properly. Unintended weight loss or difficulty gaining weight. Nutritional deficiencies, especially in B12, iron, and fat-soluble vitamins like A, D, E, and K. What's tricky about SIBO is that its symptoms overlap with a lot of other conditions, like irritable bowel syndrome, IBS, lactose intolerance, or food sensitivities, making it hard to pin down. So, how do you actually diagnose SIBO? If you find this video helpful and informative, please support the Healthy Pantry channel by leaving your comment below, liking this video, and subscribing for more daily health and nutrition tips. There are a few ways to diagnose SIBO, and one of the most common and least invasive methods is the hydrogen and methane breath test. Here's how it works. You drink a special solution, usually glucose or lactulose, which feeds the bacteria in your gut. If there's an overgrowth of bacteria in your small intestine, they'll produce excess hydrogen or methane gas. The breath test measures the levels of these gases as you exhale over a few hours. If levels spike within a certain time frame, it's a sign that bacteria are fermenting the sugars in your small intestine. The breath test helps to identify whether you have hydrogen-dominant SIBO, which is more associated with diarrhea, or methane-dominant SIBO, often called IMO, intestinal methanogen overgrowth, which tends to cause constipation. So what do you do if you've been diagnosed with SIBO? The key is to reduce the bacterial overgrowth while also addressing the root cause so that it doesn't come back. Let's look at the primary treatment options. One of the most common treatments for SIBO is a course of antibiotics, particularly rifaximin. Rifaximin is unique because it stays mostly in the gut and targets the bacteria there without being absorbed into the bloodstream, which reduces side effects. If you have methane-dominant SIBO, a combination of rifaximin with another antibiotic like neomycin might be prescribed. A big part of managing SIBO is what you eat. You might have heard of the low-FODMAP diet, which restricts certain carbohydrates that are easily fermented by gut bacteria. It's not a long-term diet but can be helpful in the short term to reduce symptoms. Another option is the specific carbohydrate diet, SCD, which limits complex carbs that can fuel bacterial growth. For more severe cases, some people use an elemental diet, a liquid diet made of easily absorbable nutrients. The idea here is to starve the bacteria while still providing your body with essential nutrients. Prokinetics like low-dose erythromycin or prucalopride help stimulate gut motility, ensuring that food and bacteria move through the digestive tract efficiently. This can be especially helpful for preventing SIBO from coming back. Once you've treated SIBO, the battle isn't over. Recurrence rates can be as high as 45%. Here are some strategies for preventing SIBO from returning. Fix the root cause. If you have an underlying condition like hypothyroidism or a motility disorder, it's crucial to get that under control. Additionally, many people find that sticking to a modified low-FODMAP or SCD diet helps keep their symptoms at bay. Moreover, taking prokinetics after meals can help keep things moving in your digestive tract. And finally, avoid unnecessary antibiotic use. And if you're on long-term medications like PPIs, discuss alternatives with your doctor. Now let's talk about complications of untreated SIBO. If left untreated, SIBO can lead to some pretty serious complications. Malnutrition from poor nutrient absorption can cause fatigue, weight loss, and muscle wasting. You might develop leaky gut syndrome, where the intestinal lining becomes permeable, letting toxins and undigested food particles enter the bloodstream, leading to systemic inflammation and food sensitivities. SIBO can also increase the risk of vitamin deficiencies like vitamin B12, which can cause neurological problems over time. So, there you have it. SIBO is a complex and often misunderstood condition, but with the right diagnosis and a combination of treatments, you can tackle it head-on. Whether you're dealing with hydrogen, methane, or hydrogen sulfide SIBO, remember that the journey is about finding what works for your unique body. And the goal isn't just to get rid of the bacteria, but to restore balance to your gut and prevent recurrence. If you found this video helpful, don't forget to like, subscribe, and hit that notification bell so you never miss out on more gut health content. Let me know in the comments if you've had any experience with SIBO, or if you have any questions. I'd love to hear your thoughts. Thanks for watching, and take care of that gut. Thank you for joining us here at the Healthy Pantry. We hope you found the information valuable and inspiring. Remember, your health is a journey, and we are here to guide you every step of the way. Thank you for watching, and we will see you in the next video.